Kenya is indeed 50. Welcome back to Morning Express. We're glad you're watching 7:06 a.m. on this 11th day of December, Wednesday, ahead of that long weekend. Yay for everybody who gets to not work and just rest and enjoy. But as Kenya marks 50, one of the things that really shouldn't be happening is hearing of deaths as big a number as 200,000 being caused during childbirth. Maternal deaths is what I'm talking about. And joining me in studio, two ladies talk about this on Your Health segment. We always just have a little time to discuss matters Your Health every Wednesday. And Anne Waroi, midwife with AMREF, thank you very much for joining us this morning. Annie Wambita, foundation manager, Chase Bank, also thank you both for being with us this morning. Maternal death, many people dying, very many women dying during childbirth. Take us through the numbers and where we stand as a country, and also what we're talking about when we're talking about maternal death. At what point do we lose these women?
Okay, thank you so much, Sophia. Maternal death, if I may start with, maternal death is when we lose a mother during childbirth. This is from the time the mother gets pregnancy until the time the mother gives birth, delivers the baby, and in that period we lose this mother. So that is what we refer to maternal death. Okay. It is a worrying trend in Kenya right now, where we stand, because the numbers are really high. We are all worried out of the trend, and this is why we are calling everyone. We come and do something so that we might reduce these numbers. And if you can be able, we stop talking about maternal death. Okay. Yeah.
When you say it is worrying, what is worrying? Where do we stand? What are those numbers? In your email, something about 200,000 deaths a year. Yes. Is that in Kenya?
Yes, that is in Kenya.
That is huge. 200,000 women dying every year.
Yes.
Wow.
They do. They die.
Yeah.
Because in Kenya, you know, Sophia, we have different kinds of people in Kenya. We have those in the higher rank, middle, and the low levels. So when it comes to maternal death, we really need to create awareness to these women, especially those who are in the lower levels. Yes. Okay. Yeah.
All right. And Annie, I'll come back to you. Chase Bank Foundation Manager, how do you come into this? You're a banker.
Yes. Yeah. Well, let me begin by introducing the Chase Group Foundation, which is the CSR arm of Chase Bank. Basically, we deal with women empowerment and environmental conservation. So this is exactly what happened. We have horrifying statistics on maternal death. About 95% of the numbers she's given you is in sub-Sahara itself, Kenya included.
Yeah.
So we have very few midwives, if at all, birth attendants, traditional birth attendants who are not trained well, or if not trained well, at least haven't gone through a professional course.
Yeah.
Now, AMREF came up with an initiative known as the Stand Up for African Mothers, which is an initiative aiming at training 15,000 midwives across Africa, which will help us reduce maternal death by at least 25%, which I'm sure you know is within the MDGs of 2015. So in Kenya alone, to reduce maternal mortality by 25%, we need to train at least 1,500 midwives before 2015. So the Chase Group Foundation, through Chase Bank, approached AMREF, and they're like, wait, we both have passion for the same initiative, empowering women. We all know by empowering our mothers, we empower families, we increase income, healthier children, you know, source of education for children. So we partnered with AMREF in 2012 through a sponsorship, where we'll be we sponsored them for 45 million to be stretched out through this 3-year plan before we reach 2015.
Right.
So we're helping, together with, of course, other AMREF partners, we're trying to help AMREF, you know, reach these targets. So last year, we held our fast walk. Over and above our commitment to AMREF.
Yeah.
You know, just calling in other partners, calling in individuals, our staff members, etc., to help us raise more funds and help them attain their goal.
All right. And of course, the funds being raised to be able to train the midwives at the end of it all. So, of course, Anne, coming back to you, the biggest concern, and as you said, the poorer families and the mothers, the pregnant women at that level will be the ones getting affected by this particular trend. The deaths usually will be seen at that level. But other than the fact that we do not have trained personnel, people to help them through this pregnancy period in giving birth, what else, what are the other causes you'd say of maternal deaths and mortality?
Other causes, other than lacking the trained personnel.
Yes, things that would contribute.
We also lack the awareness now with the mothers.
Okay.
Because you will get mothers out of their culture and their beliefs. Instead of seeking help from the medical personnel or from health facility, they will go back to the backstreet doctors. Those are the wagangas and the wakungas, as she has said, the TBAs, traditional birth attendants. This has really contributed so much, because when they go there and something fails, it fails to work out, by the time they come to the health facility, it's already too late. And at times you get reversing the whole thing will be difficult. At times we end up losing the mother or losing the baby,
or both.
Something maybe, or both. Something maybe, if this woman had come earlier to the facility, maybe this thing would have been, it would have not happened.
It would not happen.
Yeah.
Okay, so the traditional practices playing a key role in that.
Yes.
Is there any other factor you would say, in your opinion, would contribute?
Right now, I can't say about finances, because we know our president said maternal health and childbirth will be free in all facilities.
Yes.
So the challenge that is now coming up out of that, it is now lack of enough manpower. Midwives are less comparing to the number of the mothers now who are coming to the public hospitals for the delivery, for the services.
Yeah, because in fact that is one of the issues that the government has been put on the spot for. It was a huge promise from the presidency when they were campaigning, and immediately at actually inauguration and after that, he did announce that yes, this is going to happen, free maternal health care, but that's coming without measures being put in place to ensure that these mothers are well taken care of. So the numbers are diminishing, and that is what you seek to do. So what is the event you're organizing, and how much money are you seeking to raise?
Well, on the 8th of February 2014, we're looking to hold another walk, the Stand Up for African Mothers walk. This year, we aim at targeting 30 million shillings, and of course, an over-attendance of 2,000 people. Now, these funds will give them to AMREF to continue with the initiative as we look towards 2015.
Okay. But which parts of Kenya would you say are most affected by this? Where do we witness most of these deaths?
There is like in the coastal region,
coastal,
northeastern parts, and in the Pokot side. Is it the northeastern?
Northern Kenya.
Northern Kenya,
Okay. And you're a midwife. Take us through some of this training that is required. I mean, what is it a long training? What is the process that one is taken through to be able to be a certified midwife?
First, one must have completed the secondary school. You should have the grades C+ and above. Then from there, one joins an accredited college that offers nursing as a course, because mostly nowadays we don't have midwife training as midwives alone like it used to be before. We have a few colleges that are training midwives only, but it has now been integrated with a theatre general nursing, so it is nurse come midwife. So you just can join the training. We have the training which are offered by the government, the MTCs, medical training colleges, and we also have the private ones offered by the mission hospitals and the like. So when you are there, you train, as a nurse. But in part of training, there is the midwifery course, which you're supposed to pass as well, yeah.
Okay, so of course you mentioned some of those qualifications, and I'm sure most of these women in the rural areas will not have, perhaps for some even an education. You're talking about a C or C+. So when we're talking about this money going into training, it will be specifically to empower them with what should be done in that period of pregnancy when they're taking care of a pregnant mother and after. Is that correct?
Correct. But over and above that, it's also to create awareness.
Yeah.
You know, amongst everyone. You know, because maternal mortality might not necessarily be only for those in the rural areas and the peri-urban. You have even some people in the urban areas who don't know the basics about pregnancy and the pregnancy period. So we want to create awareness. We want to train midwives, and we want to ensure at least if we could at least train a few midwives. Then after, you know, allow the traditional birth attendants to get basics, you know, professional basics from the midwives we've already trained. It would help cut those statistics, you know, by a good percentage. And also to help them understand that to create the clear cut, when do I begin, when do I stop, when do I hand it over to the professional, and etc.
It's good you bring about the aspect of raising awareness, because it's one thing to train the midwives, it's the other for those who need their services to know that they're there and why it's important to seek their help. But how will you go about raising this awareness? Because these are remote areas. That means, you know, just for most where we see these numbers tilting on the higher side, how will you conduct this? How will you ensure that this information trickles down to that woman in Wajir, in Pokot, even in Nairobi? At the moment, of course, thanks to media and the media fraternity, we've been able to create awareness. Even from the walk itself, you know, we've been able to create awareness. Over and above that, AMREF have a great network of clinics across the country, across Africa, you know, and we're trying to use these points to bring the message out there. So all right, at what point are women, pregnant mothers, pregnant women expected to start consulting or engaging a midwife? You're one. So at what point does that engagement begin?
Before, it used to be immediately, you know, you've conceived, you're supposed to seek medical attention. You start your antenatal clinics. But right now, because out of research, you know, medicine is dynamic and things keeps on changing. Research are done every day. So out of the researches, it was believed that when these women start the antenatal clinic early, maybe I know that I'm pregnant today and I start my antenatal clinics today. Before I reach 9 months, higher chances were at these women pull out of the way. They don't even come anymore. And maybe the time they are now pulling away, it is the time the complications have started and they don't know, they are not aware. So what it has been done, it has been organized for a woman who is pregnant to visit the facility for 4 times throughout the pregnancy period. First, you go when your pregnancy is between 1 and 16 weeks. But if you have any abnormality that you're feeling, you seek medical attention. It is not fixed that you should go only at that time. If you have something unusual, and those who come, we always give them an education in the morning, a health talk in the morning before we start, so that we tell them, we teach them about the danger signs to observe anything. So when you feel such a thing, you seek medical attention immediately. So nowadays they are coming for 4 times. Between 16th week, first week and 16th week. Then from 16th week to 28th week, they come the second time. From 28th week to 32 weeks, they came the third time. And then from there, they come for the last time. Therefore, it is called focused antenatal care, whereby when you come, Sophia, you are pregnant, you get me, I will educate you, whatever it is expected of you during that time. And when you go back, you experience something unusual, whether it is a headache and it is persistent.
Yes.
Immediately go back
Okay.
to the clinic.
All right, so that is before birth.
Before birth.
The birth period comes, and then there's the after, the postnatal. Are you still engaging with this woman at that point?
Yes, after birth, they usually come after 2 weeks of delivery.
Okay.
They come for the checkup. We check the baby, how the baby is progressing, the umbilical stump, how she's cleaning the stump. Is it infected? We check it. We also check the mother, how is she breastfeeding, because we have so many mothers. We assume it, but so many mothers out there, they don't even know how to attach the baby to the breast. And with this alone, it bringing so many problems to the mother, and we end up having a malnourished baby, that a small baby, you can imagine. Yeah, because of poor attachment to the breast. So they come immediately after delivery in the maternity unit. The midwife there explains and demonstrates to this mother how to breastfeed. Okay. And after 2 weeks, she comes back. We check the baby and we check the mother. We check even the attachment to the nipple and the like. Okay. Yeah.
All right. As we bring this to a close, Annie, right now the medical workers are on strike. Of course, the whole conversation going on between them and the government over the healthcare and whether it should be devolved to the counties. But you, in your CSR and others coming together to support this, to see that the midwives are trained. But of course, there is a role that the government must play, because with the pledge to ensure there's this free maternal health care for all the mothers and the women out there, what would your call be to the Ministry of Health, to the other stakeholders, and what their role must be in ensuring these numbers, 200,000 a year, are brought down?
First and foremost, let me commend the government for having taken the first step to, through the president's decree, of course, to declare maternal care free for all. So I guess for now it's going back to the drawing board. Yes. We have these services out there for free, but who are going to offer the services? Through Chase Group Foundation and the partnership with AMREF, Stand Up for African Mothers, and of course with other valued partners out there, it's attainable. It's attainable. So far, AMREF has managed to train 5,000 midwives across Africa. Right. And in Kenya alone, out of a target of 1,500, they've managed to train over 700. So we're almost reaching 2015, and we've already surpassed a third. So it is attainable. Yeah. So for now, it's going back to the drawing board and just decide, okay, fine, we have given free maternal care. So how then do we provide people who can give these services to our people?
Okay. Yeah. And finally for you, Anne, what do you think is very important, your word and message to the stakeholders, government included? As she said, commended, yes, for the first step to have them free, but now the challenge is they're free, but who's gonna, provide the services?
Okay, for me, I would call upon all the stakeholders to join hands with Chase Group Foundation and with AMREF and with any other organization. Not only AMREF, which is training midwives. We also have medical training colleges. So please, even if it is your personal as Sophia, you can do something and see to it that at least that woman who is your neighbor there, that woman whom you saw who is pregnant, at least she will get the best that she requires. Okay. Childbirth to me is not supposed to be welcomed by tears.
It should not, never.
Yeah. Childbirth, from the day of conception to the day of delivery, I think it should be happiness throughout, happiness and joyous. It's a gift, and everybody should celebrate this. And this is why I'm calling upon everyone, individuals, corporates, and everybody. Come together, let's join our hands, let's stand up for this African woman. And more so, let's remember our Kenyan mother. Because if it were not for Kenyan mothers, we would have not been celebrating these 50 years of Kenya. True. ingetoka wapi?
True.
Yeah.
Well said.
Yes.
Well said.
Yes.
Okay.
So let's all embrace our mothers. Let's all remember these women. It doesn't matter how old is this woman, because we are having these small girls who are conceiving. And I'm calling upon all men, because whenever there is a child, there is a man involved. Let's do something.
Yeah.
Men should be on the front line. Yes.
In this conversation as well.
They should be involved.
Okay.
From the time of conception,
yes,
they were involved.
Yeah.
Even the time of antenatal clinics, these men should be there with your wives. It did not cost you much.
Thank you.
Yes.
Thank you very much. Anne Waroy, midwife with AMREF, thank you. And Annie Wambeta, Foundation Manager, Chase Bank. Ladies, both thank you for being here with us and talking about this, because as we've been saying, Kenya is marking 50 years. It's a huge moment. And to hear that we have at least close to 200,000 lives, women dying in childbirth, that is unacceptable. It should not be happening in current and modern day Kenya. But of course, even as you near your event, you will tell us more about it. It's February next year. We will remind Kenyans so that as many people who would want to can participate to raise funds to be able to train these midwives to ensure that maternal mortality, those numbers diminish. Again, 200,000 women every year dying due to this. That is unacceptable for this country.